We've all had to go to the emergency room, spend time waiting for what seems like forever before getting treated. And then, after all of that, the fun continues weeks later when we get an astronomical bill. Or perhaps you're on the other side and you see patients coming in for non emergencies at your facility, leading to wasted resources, time, and money. Well, we have a solution, and it's called telescreening. The goal of our program is to provide accurate screening of emergency room walk in patients through an efficient assessment using the telescreening kiosk, which determines the right department needed for treatment. Our telescreening kiosks will 1. Provide relief for the inundated staff in emergency rooms, 2. Route walk in patients appropriately to the lab, radiology, emergency, or the clinic where assessments would take place, and 3, reduce waiting times and unnecessary treatments. Note that this program does not affect ambulance or EMS patients. First, we'll dive into a bit more detail on how the program aims to achieve these goals. By enabling effective and efficient patient routing, patients will be distributed more evenly throughout the healthcare facility, thereby reducing wait times and wastage of resources, improving patient and staff satisfaction, and of course, reducing costs for both the facility and patients. Then we define some metrics that will be used to measure program success. Our metrics include triaging errors, which indicate failure to correctly assess the severity of a patient's condition, and processing and wait times, which determine the entire visit time from arrival to triage and triage to treatment. Satisfaction indicators will include patient and staff ratings, while other indicators include cost of triaging, how many resources are being used, and the outcome of the care delivered. To implement telescreening, we will follow a cost reduction model that involves preventing extraneous costs by reserving resources. The program provides value to healthcare entities by ensuring productive workflow processes through routing patients to receive the right care at the right time. It also provides patient-centered care, thereby combating some of the social determinants of health leading to unnecessary visits, increasing accessibility to healthcare services, and honing clinical focus. Securing funds for the program would involve exploring multiple avenues of financing, such as government or private grants, foundations, and professional organizations. 3 of the most promising grants that support telehealth programs are the COVID-19 Telehealth Program, the Connected Care Program, and the National Telehealth Resource Center. Now let's talk about technology. The healthcare kiosks will be located outside of the and will feature a touchscreen with a speech recognition interface. For those unable to use the touchscreen, the speech recognition will enable them to use the kiosk. And otherwise, since most people know how to operate a phone, a touchscreen will require a minimal learning curve. We estimate that a 350-bed hospital that gets around 2,500 visits a month will require 4 kiosks. These kiosks will be evenly spaced out and have screen filters to ensure privacy of each patient. Every kiosk will be attended to by kiosk navigators, who will be responsible for assisting walk-in patients, ensuring a streamlined patient flow, and maintaining the kiosks. These navigators will be manning the kiosks at all times. And now for the kiosk interface, which is a chatbot and real-time video teleconsultations as needed. The chatbot will collect appropriate patient information, which is fed into a decision support system. This AI-based system translates and processes the patient's answers to eventually route them to their best clinical care setting. In cases of teleconsultation, the patient will be connected to an RN or a PA overseeing the command center. The command center, located inside the hospital, acts as the brain of the entire operation. Moving on to legal and licensing requirements, we foresee no issues with EMTALA or medical licensing. Since the telescreening program only changes the routing process, every patient still undergoes evaluation and stabilization as usual. Talking about licensing, the program is attached to a single healthcare facility, so normal state licensing requirements would be followed. Additionally, all devices, communication, and training will comply with HIPAA regulations to include enhanced cybersecurity measures. To recap, telescreening solves the existing overcrowding issue for both patients and staff. The patients receive faster treatment at a potentially lower cost, while hospitals stand to benefit from preventing unnecessary treatments and services. In the end, day or night, telescreening does it right.